And finally, and probably foremost, we educate. So we talk to our clients about what's going on in their body and in their muscles. We also talk about nutrition, exercise. We have a woman on staff who has her master's degree in corrective exercise. And we do things, supportive things like meditation. There's lots of great research on meditation. I've had 20 years of experience teaching it. So we do that. I'd like to just finish by telling you about two of our clients so you really get an idea of how this works. So I've got two client histories, and both of these ladies I've seen in the last week, and they're thrilled when I tell their stories. So I'm really excited to share with you about Karen and Shirley. So Karen came to me 5 years after her last radiation treatment for leukemia. And she reported that she had experienced severe pain throughout her body for 5 years. And she was also experiencing numbness and tingling in her extremities. They were treating it with physical therapy and opioids, and she was not getting any relief. So somebody sent her to me. And I began by just doing simple circulatory and lymphatic massage. And immediately she started to see a change. Her tissues were very dense with congestion, and so she wasn't getting blood flow to her extremities. Later on, I found that she had a lot of deep muscle tension in her shoulders that had happened before her treatment. And so we did that work as well. And now she has no neuropathy. And I would report that the only pain she tends to experience is self-inflicted when she goes to the gym. So she's a success. Shirley, on the other hand, is a different kind of case. She came to me 6 months after a mastectomy on the left side. She was already experiencing lymphedema down her arm, but she also had a great deal of pain because they had done the DEEP procedure. So she had a large scar across her abdomen. She felt like her abdominal muscles were really strapped down. She described not being able to stand up straight. And she had a great amount of low back pain. So she actually came to me for the pain. She was referred to me by the Pink Group. And what I did was I softened the scar tissue. I flushed out the abdominal cavity. She had a lot of congestion there. There were a lot of adhesions around the scar. And I was able to do a lot of deep work on her low back. And her pain was relieved, her posture was improved, and I was able to support the work she was getting in physical therapy for her lymphedema, and she's had improvement there. However, Shirley got a second diagnosis this spring, and she has a second kind of cancer in her right breast. So she was scheduled to get a mastectomy and told that there was a high probability that she would possibly have a reoccurrence of the lymphedema in the left side and a new occurrence on the right side. So she came to me and we came up with a battle plan. And I worked on her 3 times before her surgery to release muscle tension in the area where they were going to do the second incision for reconstruction. Also to strengthen her lymph and to relax her for the surgery and relax her muscles. She went through the surgery with flying colors, with no excess pain. I saw her 2 weeks after the surgery and worked very gently, did relaxing massage and circulatory, went on to do lymphatic massage and worked on the scar tissue. She's had no pain and no reoccurrence of lymphedema. And what we really have seen is that lymphedema is much more easily prevented than reversed, because once those tissues are engorged, it's really hard to get them back to normal. So I love working with Shirley, and I'm really glad she's doing as well as she is today. Does anybody have any questions? Yes? We certainly can, absolutely. A number of our staff members do energy work and Reiki. Yeah, with our experienced staff, there are so many different kinds of skills we can bring to bear. That's a great question. I love hearing somebody ask about Reiki. Yeah, yeah. As a matter of fact, I think right now, I think all of our staff does Reiki. Anything else? So today we're going to do a little massage for you. We also brought, so please tell us when you have areas that you would like worked on, or ask if massage is something that might help you with an area of chronic pain. I find a lot of times that people think, oh, well, massage isn't going to help with that. You'd be surprised. And we brought goodies for you. Everybody will get a coupon for $20 off a massage at Light Hand. And we also have a sign-up sheet. If you're willing to give us your name and email address, we're going to give away 2 full massages. And we have brochures, and in the next couple of weeks, we will have brochures geared just to the oncology floor, available on the floor for patients. So I would love to talk to anybody who has questions about how this might work for their patients. You can call and talk to me anytime. That kind of service is completely free. So thank you so much for having us today. Have fun.